Bismillahirrahmanirrahim. Now we are at the level of functions, which we are going to discuss the functions of the hypothalamus. Along with that, we are going to discuss certain clinicals, because when the functions are not working properly, there would be damages, and hence we are going to have clinical symptoms. First of all, we have the autonomic control. This is number one. As you know, hypothalamus is a major center and it is going to control the autonomic nervous system. The craniosacral outflow from the reticular formation is going to control parasympathetic system, whereas thoracolumbar is going to control the sympathetic system. So what actually happens is that the parasympathetic system is actually made by these anterior and preoptic area, and both of these nuclei, they are going to have a parasympathetic or rest and digest system, in which blood pressure will be decreased, heart rate will be decreased, the contraction of the bladder will be there normally, and motility of the gastrointestinal tract will be greater. But in the sympathetic system, that is fight or flight system, the posterior and lateral nuclei are involved, and they increase the heart rate, the blood pressure, they stop the gastrointestinal tract, they do pupillary dilation, and they cause hyperglycemia. After this autonomic control, we have the second function, and as you know, we were studying again and again that there were these a lot of nuclei, the paraventricular, the supraoptic nuclei, etc., which we can see over here as well. The supraoptic and paraventricular nuclei, which are giving information to this posterior pituitary, and the anterior pituitary is getting information from the blood vessels through the medial eminence and fundibulum. So this is how your hypothalamus is related to the endocrine system. And the hormones of this endocrine system, they can act directly, like these thyroid stimulating hormone, luteinizing hormone, follicle stimulating hormone, and they cause their direct activity. But sometimes there's indirect stimulation, that through an endocrine organ like the adrenal cortex or adrenal medulla, this hormone, it acts on the adrenal cortex and causes the production of the further hormones, which are going to then influence the activity. So the negative and positive feedback, it is controlled by this endocrine system of the hypothalamus. Now we have the neurosecretion, vasopressin and oxytocin. And if we have this nice diagram over here, so in this diagram we can see the supraoptic and paraventricular nucleus, they were releasing vasopressin and oxytocin into the posterior pituitary. So this is how the neurosecretions are going to be controlled. One thing about this situation is, for example, this posterior pituitary stops working. That happens in our disease, which is known as the diabetes insipidus. The supraoptic nucleus, which is going to produce the vasopressin, it is interrupted, the pathway is interrupted, as a result of which what will happen, the large volumes of the urine will be produced. When the ADH or the vasopressin is working, what it does, it's an osmoregulator. When there is lack of the water in our body, it does vasoconstriction to conserve the water. But in such a situation, due to the lack of this, large volume of the urine will be produced, and it will have low specific gravity. It means it will be dilute urine, as a result of which person will be thirsty, and they will want to drink large amounts of the fluid to conserve the body water rate, that is a 70%. That is how lack of this pathway is going to cause diabetes insipidus. Lack of the ADH from the supraoptic nucleus is going to cause diabetes insipidus. Now, after neurosecretion, we are going to discuss temperature regulation. So the anterior and the posterior nuclei, they are involved in temperature regulation. The crux is that the anterior nucleus is going to do vasodilation. Vasodilation is going to cause heat loss. The dilation of the skin blood vessels, what will happen? There will be excessive sweating, or the loss of the heat from the body by means of sweating. But when the posterior is stimulated, it is going to cause vasoconstriction, and it is going to allow the body to gain the heat, produce the heat, shrugging of the skeletal muscles and shivering mechanism. Normally, the hypothalamus, it sets our body temperature. If you measure the body temperature orally, it comes out to be 98 degrees Celsius to the 98.6 degree Fahrenheit. This one is the measured in Fahrenheit, that is made orally, but when you measure rectally, it comes out to be 18 degree Fahrenheit. It is very important because these questions, this natural body temperature is very much important, and it is maintained by your hypothalamus. And whenever that situation is not working, your body will have hyperthermia or hypothermia. It is due to the lesions of the hypothalamus or due to any head injury. The anterior and posterior nuclei, they are damaged, as a result of which patient with hyperthermia has no signs of malaise. But so whenever there is going to be a lesion of the hypothalamus, your body will influence hyperthermia or hypothermia, that is apart from the pyrexia, that is due to the fever, etc. After regulation of the temperature, we have regulation of food and water intake. So firstly, the food intake, it is controlled by lateral and medial nuclei. The lateral one is called the hunger center, and when the hunger center is not working, your body will have anorexia. Anorexia means lack of appetite. And the medial is the satiety center. Satiety means it is going to maintain your appetite. Now it is going to actually control your appetite, and when there's damage to the medial system, what will happen? You will have over appetite, etc. And this lateral system is also concerned with the thirst, so it is also known as the thirst center, and it detects the osmolarity of your body along with the supraoptic nucleus. The supraoptic which was involved with the vasopressin release. So this is how the lateral nucleus is involved in the thirst center and the hunger center as well. And when it's not working, it is causing anorexia. And medially, it is the satiety center. And when the satiety center is not working, you will have uncontrolled voracious appetite and you will have extreme obesity. We can also see this over here, that obesity and wasting. Severe obesity, what will it cause? Due to the hypothalamic lesions, it will cause your genital hypoplasia or atrophy. Your male and female genitals, they will be having atrophy. Their alveoli, their secretions, they will be impaired. That is how obesity causes wasting. And wasting is less common than obesity. Severe cachexia is suggestive of damage to the hypophysis, the pituitary gland. So cachexia actually means that there is wasting of your muscle, loss of your muscle strength, and this loss of the muscle strength is mainly not due to nutritive function but due to this hypothalamic lesions. Also, I told you that hypothalamus has efferent fibers, and these efferent fibers are going to control your limbic system by the prefrontal cortex. So it will control your expression of emotion, your heart rate, your blood pressure, etc. So when the lateral hypothalamic nuclei is there, it is going to control your rage. But whenever the lateral hypothalamic nuclei is not working, it is having some type of disorders, it is going to cause passivity. You will not be responsive to certain actions. And the ventromedial nucleus, it is involved in passivity. And whenever it is destroyed, it will cause uncontrolled rage. So that is how the emotion system is controlled. But what happens in sometimes that emotional disorders are going to take place due to these disturbances in the lateral as well as the ventromedial nuclei. What happens is that the patient starts to weep or laugh. They have maniacal outburst, uncontrolled rage, and uncontrolled rage was due to this ventromedial nucleus damage. Depressive reactions due to this lateral nucleus damage and maniacal outburst. These are seen with patients having hypothalamic lesions in these regions of your hypothalamus. Now, control of the circadian rhythms. What are circadian rhythms? Your sleep and wakeful cycles. And whenever your descending system were involved, that were descending system going from your hypothalamus to your spinal cord, they were passing to this reticular formation, and this reticular formation is actually your sleep and wakeful cycle controller that is going to control your circadian rhythm. So for example, your retina of the eye, it is going to detect the variations in intensity of the light, and then it is going to pass them to suprachiasmatic nuclei, and this suprachiasmatic nucleus through the reticular formation controls your circadian rhythms. And the circadian rhythms include the body temperature, adrenocortical activity, the eosinophil count, and the renal secretion. And whenever the circadian rhythms are damaged, what will happen? The person will have sleep disturbance, that the sleep will be short periods, and they will have insomnia, that is unable to sleep, and this insomnia is seen in hypothalamic lesions. So this is how, when your hypothalamus is not working properly, it causes your obesity and wasting, your hyperthermia and hypothermia due to the inability of the working of your anterior and posterior nuclei, the diabetes insipidus due to the lack of working of the supraoptic nucleus, sleep disturbances due to the lack of working of circadian rhythms, emotional disturbance due to lateral and ventromedial nucleus lesions. Now they tell you that whenever you are going to have acute type of lesions, there will be more sign and symptoms, but the slowly growing tumor, it is going to adapt and it is not going to cause extreme type of sign and symptoms. This is how we end with our chapter of the hypothalamus. I hope you understood each and everything. I will meet you in another chapter in another time. Till then, please like, share and subscribe to my channel. I am a small channel, so it really helps whenever you like and share and subscribe. So please subscribe. It helps me to make all these videos. Allah Hafiz.